Welcome to this month's Ask Dr. Kristina. I am really excited to be here today to talk to you about the very common and very overlooked H. pylori hidden infections. From people who have H. pylori to people with symptoms that don't know they have H. pylori to H. pylori being a trigger of their autoimmune condition that no one has discovered yet. This is a big topic close to my heart. It's how I got into functional medicine. So, without further ado, let's start. The H. pylori hidden infection. And could this common stomach bug be driving your reflux, your IBS, your low iron for no reason? So today we're going to talk about the surprising link between these things and what you can do about it. Let me just, all right. Have you ever wondered if the heartburn, the IBS, the tummy troubles you have, the low iron for no apparent reason, even though you eat red meat, you may not be menstruating, um, have you ever wondered if it could be all due to a bacterial infection called H. pylori or something else that's not working correctly in your body? Constant heartburn, stomach discomfort, low iron levels, they're often seen as a result or a symptom of a chronic H. pylori infection. It's frequently missed. So in this webinar, we're going to talk about what is it? What is H. pylori? What kind of impact can it have on your gut and on your body, your immune system, and your whole biochemistry? What kind of treatment options we see from the conventional medicine to natural approaches, and then tips for gut health and recovery if you have H. pylori. Now, I do have a couple of people coming on here today to watch, and I know because we've spoken over the last couple of weeks because you have either previously had H. pylori or have the symptoms of H. pylori. So I hope that you can glean some pearls today and start yourself on your healing journey. Now, remember, this information is for learning. Oh, only always consult your doctor or your healthcare practitioner for advice that's specific to you. These are just general things, but something that you should be aware of. Okay, a little bit about me. I have been a chiropractor for 26 years now, and I've been practicing functional medicine for over a decade, working with kids and moms and families and people in my community. I love uncovering mysteries. When I took my training in functional medicine, this story is actually very pertinent to the H. pylori. I had no symptoms of any kind of infection, no reflux, no IBS, some bloating. I had three small kids. I was running around like a crazy person, running a clinic, trying to eat well, trying to do all the right things, and was always kind of bloated. Whenever I went for blood work, my doctors would say, "You have low iron, so you must menstruate heavily." And I would say, "Nope, not really. You probably don't eat red meat." And I would say, "Yup, I eat a lot of red meat." And they were like, "Oh, that's just normal for you." And that's what kind of started me digging. That had been for quite a few years like that. And I was eating all of the right things to increase my iron. Um, and when I came across a colleague who was practicing functional medicine, we did some testing and realized that I had a latent, so unknown H. pylori infection. It had probably been chronic. And I also had an autoimmune condition called Hashimoto's thyroiditis, which can be triggered by H. pylori. So now I had this big diagnosis, this explanation for what was wrong with me, but I didn't know what to do. And so many people I speak with have IBS that's unexplained. They don't digest their food well, they bloat, they have low iron, they have B12 deficiency, but they're eating all the things they need to eat. And sometimes it's this latent bacterial infection that we don't check that is really creating havoc in our whole digestive system. And I'll explain to you later. When I started practicing functional medicine and studying, it was truly driven by my own autoimmune condition and gut. And H. pylori was one of many things, but it was one of the things that triggered my autoimmune condition. Um, I quickly went and studied a lot of gut and autoimmune training at the Institute for Functional Medicine and with the brilliant Dr. Karazian. I got certified in functional pediatrics because I have a big pediatric practice in my chiropractic clinic. I got certified as a wall practitioner and also in something called the Bredesen Protocol for reversing cognitive decline and Alzheimer's. Today, my specialty is gut and autoimmune, and I like to see everybody because we can all benefit from having better gut health and better digestion and more of our biochemistry working correctly. One of the things that really inspired me when I was trained by the brilliant Dr. Terry Walls, who put her MS that was quite devastating to her She was in a wheelchair, unable to almost hold up her head in a tilt recline wheelchair. One of the things that really inspired me was that the basis of her healing was through food, and that food and diet and lifestyle were a foundational aspect to every single part of her protocol. That it wasn't just eating a certain way for a period of time, and then those functional medicine testing to find out really what were the triggers that were creating some autoimmune system havoc in her that had led her to this place. And this is the one of the most inspiring things that I've ever done. She's probably one of the most inspiring people you can meet in terms of healing and understanding that anything is possible, if you understand what to look at and how to fix that problem. So, this is my approach to healing. So, let's talk about symptoms that may look like H. pylori: persistent heartburn and reflux, bloating and nausea, frequent burping, and then stomach pain. Most people, their doctor, their conventional doctor, might suggest testing for H. pylori if they have heartburn, if they have ulcers, or if they have this recurrent stomach pain that's kind of, let me just show you, like right above the sternum. That's typically where people feel it, but it's not the case for everyone. It wasn't the case for me. I was completely asymptomatic. I had nothing. So what are some other clues that your symptoms may be coming from an H. pylori infection? That you have this unexplained low iron or B12, even though you eat enough iron containing food and you have enough eggs and animal protein in your diet to have the right amount of B12. IBS-like gut symptoms or severe acid reflux. And that doesn't go away with a specific diet like a FODMAP diet. And then brain fog and fatigue after eating. This is one that actually gets missed often. Um, Sometimes when you have an H. pylori infection, we'll go through it a bit later in the talk, it totally disrupts the way you digest food. So you get a lot of brain fog because you're not digesting food. So if you're one of those people that gets brain fog every time you eat, and it doesn't really matter what you're eating, and fatigue, you may have a latent or hidden H. pylori infection that maybe no one has uncovered. So what I'm going to cover today, I have a lot to talk about. I'm going to try not to go on tangents, but for those of you who know me, I like to explain and I like to share. So I'm going to give you a concise overview of H. pylori, the nature of the bacteria itself, its impact on health and treatment. We want to understand what H. pylori bacteria is, common symptoms, who's at risk. Although in my clinical experience, I've seen many people at risk, how it affects stomach acid, gut bacteria, and the absorption of nutrients, and then how it's connected to ulcers and cancers and triggered by autoimmune conditions, plus current treatment options and things I've seen in my practice. I am going to perhaps, Michael, if you could, let me see, if you could perhaps send a question in the chat, I can look at the chat. Um, if that would help. I don't know how to actually unmute you. Um, so I can look in the chat if you have a question about what we're talking about, and I can keep checking it to make sure that I've seen it. Okay, so that's what I'm going to cover today. There we go. Okay, so what is H. pylori? Really prevalent bacteria. H. pylori or Helicobacter pylori is a corkscrew-shaped germ that thrives in your stomach. It's a bacteria. Now, we are born with a little H. pylori, and actually, under the age of 6 or 7, the research shows that having some H. pylori is quite beneficial, especially for respiratory health. And so when we see kids with small amounts of H. pylori, we don't worry too much. There's a little bit of a reference range, and small amounts of H. pylori are not damaging to your body. We don't eradicate it. Again, we haven't quite figured out why we need a little bit of it, but it seems to be beneficial for some biochemical processes and some processes of life that we might need. How does it spread? It's really, really contagious. So people get it in childhood most often. That's what the research shows, but really easily spread amongst family members, loved ones. If you share cups with people, you're kissing people, it's very common and it's very persistent. Some of the research shows that nearly half of the world's population can have it, and it can even be dormant. So, like me, not having many symptoms, but creating issues behind the scenes. Sometimes it can cause irritation. So, for those of you who are here, because you've had reflux that's not been explained, or ulcers, or digestive issues, you're one of those people that maybe that H. pylori infection is giving you significant symptoms. But symptoms alone can't help us diagnose it. So we want to do specific tests. Doctors do breath tests and blood tests. You can also do a scope. In our clinic, the stool test that we use as a functional medicine practice has an H. pylori screen in there as well, and it's very sensitive, which is why I like it. It's one of the reasons how I found that I had an H. pylori infection. I had done other stool testing that hadn't shown H. pylori. So the right tests are important to make sure you get the diagnosis, and then understanding the effects of the H. pylori in your gut, but also how to eradicate it and then how to repair your digestive system afterwards are important. Let me just see. Okay, no one posted a question. So hopefully you just put your hand up and you weren't trying to ask a question. Okay. So we have stomach acid in our stomach, hydrochloric acid, and that's its primary function is to sterilize the stomach and sterilize things coming into the gastrointestinal tract right at the beginning so that we don't ingest pathogens and bugs. But H. pylori is very clever and it's evolved over the years to survive and thrive in your acidic stomach. What it does is it hides in the mucus. So there's a protective mucus layer and it will burrow itself into there and you can see it's going gross and it will hide from the acid. Then what it does is it produces chemicals that start to decrease stomach acid, neutralize it, so it creates a little bit of a protective zone around it. And that way it can proliferate. And then over time, it can create ulcerations and weakening in the mucus lining, and other severe issues. So this is why even when you've gotten your H. pylori and eradicated your H. pylori, maybe through conventional means, maybe through integrative means, you have to then go back and fix the digestive system. And this is the piece that gets missed often. People don't retest. And oftentimes people don't go back and fix their stomach acid production. This bug has suppressed stomach acid in your body, and now you have to re-stimulate your vagus nerve and re-stimulate your body's ability to create stomach acid to start protecting you again. Assuming that you don't have any ulcers, that of course you're working with someone to look at that when you've done that. But that is one of the biggest things I see. So it proliferates by suppressing your own stomach acid production, and then it can grow. And what happens is it can burrow into the gut lining and hide for years. It can go dormant. So it's kind of a really clever bug. And sometimes, and this is the piece that's kind of interesting for people who have reflux, sometimes and not reflux other times, it can sometimes create, high stomach acid, low stomach acid, but overall, chronically, it creates low stomach acid. And when you have low stomach acid, and this is a misnomer for most people, it not only impairs your digestion, but it usually leads to more reflux. And I'll explain to you why. I don't have a good picture of it here. You have your esophagus where the food comes down, and then you have your stomach where it meets. And I wish I had a good picture for you. And there is like a trap door. It is a sphincter that closes between your esophagus and your stomach. So you eat, the food goes into your stomach, and the trap door closes, and the acid helps turn on the enzymes for digestion, which is what stomach acid also does. It doesn't just sterilize our food and particles coming into our gut. It will also help turn on protein breaking enzymes, proteases, lipase, and other enzymes. So if if that trapdoor stays open, you start to get little bits of acid coming up your esophagus. So we really want that trapdoor between the esophagus and the stomach, that sphincter, to stay closed. And that sphincter stays closed based on how much stomach acid is hitting. There's some chemical and mechanical receptors, and those chemical receptors stay shut when there's enough stomach acid. So in essence, when your stomach acid is low, and that can happen from, lots of stress as well, on top of this chronic H. pylori infection, then that sphincter is kind of slack and relaxed. And then when you eat, stomach acid comes up. When you lay down, stomach acid comes up and you get that reflux or that heartburn. So it's actually a misnomer that too much stomach acid is usually the cause of reflux. It's usually too little stomach acid. I know that's always a big one for people. People are always like, oh my God, that doesn't make sense. But if it makes sense to you now that I've explained why that's the case. So making it lower that stomach acid actually increases the reflux even more, which can create those ulcerations in the gut. We need stomach acid for our digestive health. We need it to turn on the enzymes to break down the fat and protein, like I said, to absorb iron and B12 and calcium, and also to get rid of other pathogens. So, again, at the beginning, I was speaking about low iron for no reason, low B12, even though you consume enough B12 containing food. If your digestion is off, everything down the line is off. So you will get bloating, you'll have IBS, you won't respond well to food, you'll be micronutrient depleted. And long term, we see that in patients with neuroinflammatory disorders. Heartburn has many causes, but it can stem from low acid, poor digestion, and irritation, and not excess acid. So this is kind of the like aha thing that sometimes when I have conversations with people about this, they're like, wait a second, that's backwards until I explain it to you. And then here's just a medication note. And you always want to talk to your provider. If you have really bad reflux and you've been put on medication, it's something that you want to discuss with your provider on how you can heal that problem. Because long-term acid blockers can and have been shown in the literature to lead to cognitive decline and specifically Alzheimer's, because you are not able to absorb your nutrients. So there has to be some way of absorbing your nutrients that you can work on, either supplements, and again, consulting with your doctor that prescribe your medication, and consulting with your doctor about how to go about fixing that problem is really ultimately important. Obviously, you can't do it based on my advice here. What are some common symptom patterns for an H. pylori infection? So stomach pain. Now that burning reflux pain can happen between meals or at night when you're going to bed, sometimes even in the middle of the night, but that's not the only thing. Bloating and gas, half an hour to an hour and a half after you've eaten, really common post H. pylori infection. And part of that is because of what it does to your digestion, breaking your stomach acid production, changing how you digest. Heartburn and reflux, we've talked about this, maybe even food regurgitation. Being tired all the time, even if you had enough sleep, can be like an uncommon, but very common in my practice, result of an H. pylori infection. And then this bad breath. I have a lot of patients who come in, they're like, I've had my dental work done, I brush my teeth a lot, but my breath is really bad. And that's usually because there's not enough stomach acid, usually due to an H. pylori infection. And so you're not breaking your food down properly, so it's putrefying, and that's creating that yucky smell in your mouth that has nothing to do with dental health. So that's a really common one too. So if you know someone in your life who brushes their teeth a lot and they still have that kind of weird bad breath, they may have a chronic H. pylori infection that they don't know about. H. pylori is notoriously very hard to get rid of conventionally, very hard. I've had a lot of experience with it in my practice because that's what brought me to functional medicine. That's what helped me put my autoimmune condition into remission. That's what helped me rebuild my iron levels. So, not only did I do a lot of research and self testing, I've had multiple family members with it as well. And antibiotics don't always work. Triple therapy is one of the, so three different kinds of medications have been used, and it's sometimes resistant to antibiotics. So sometimes you can get rid of a little bit of it, but not a lot. The bacteria makes this like protective layer, blocking your immune defenses and some medicines, this mucus-like layer. They can also go dormant when they're being treated. So some of them can go dormant for, a period of time. So once the treatment stops, they can come back out and proliferate. And then side effects can be really challenging. I know a close family member of mine does really, really poorly on all medications. And when she was going through her H. pylori medications, she really didn't feel well. So she couldn't take the dosages she needed to because she felt terrible. And as a result, it didn't work for her. So it can be hard to get rid of for lots of reasons, but it's a really clever bug. One of the things it makes is biofilms are things called bacterial bubbles, and we call them OMVs. Um, and it's sophisticated. It makes these bacterial bubbles or these OMVs to survive and resist treatment, and also create toxins in your body. So the biofilms it makes, they're like these mucousy, kind of slimy, protective fortresses. They're made of sugars and protein, and it helps H. pylori stick to the stomach lining, but also hide in there. And it shields them from your immune system, can't see them anymore, but also makes antibiotics less effective. So, you know, when we're treating it, we want to use a biofilm bust or something to wipe away that mucus plaque and then treat the H. pylori. So that's why there's lots of layers. That's why it's quite difficult. Um, these OMVs, these bacterial bubbles, are like tiny little packages that H. pylori sends out that has toxins in it. It creates inflammation. It creates immune system dysregulation and even some genetic instructions. So they create this resistance to treatment. It's evolved and it's very highly evolved. So we can deliver these poisons directly to stomach cells. We can increase inflammation and create ulcers. These OMBs, these little bacterial bubbles, also have been known to cross the blood-brain barrier, inducing inflammation in the brain, we call neuroinflammation. And there's even research showing that it potentially contributes to these amyloid plaques we see in Alzheimer's disease. So, for those of you who aren't familiar with Alzheimer's disease, the physiology of it, what happens is our body puts down these amyloid plaques. That's one of the hallmarks that we can see when we're doing imaging to give someone the diagnosis. And those amyloid plaques are like, I think they're like little pillows to put out fires. It's the body's, in my opinion, protective mechanism to squash neural inflammation. And we put those plaques there when the brain is inflamed and the brain cells are inflamed. And so when you have H. pylori for long periods of time, they've seen in the literature that as it crosses the blood-brain barrier, it can create this inflammatory process in the brain, which we can see in Alzheimer's and some cognitive decline. So the biofilms also do something, they quorum sense, so they vibrate to act and interact and add more bacteria and viruses to hide in there. So it's a very destructive bacteria, and very stubborn to get rid of. And then H. pylori in your own microbiome. So for those of you who are new to gut health, and maybe this is your first time even understanding that there's lots of bacteria, we have 300 million different kinds of bacteria. They say there's probably more that we haven't figured out. We have a large amount of them, and there's a balance of good and bad bacteria. The good bacteria run the biochemistry of life. They make our B vitamins and, turn our greens into vitamin K so we can put calcium into our bones and teeth. They help us make brain chemicals, neurochemicals. So, H. pylori can significantly disrupt that balance in that microbiome through many mechanisms. And then treatment can create an imbalance in your own natural gut bugs to make them so there's more of the bad guys and less of the good guys that we need in that delicate balance. That's called dysbiosis. So we know that sometimes we need medications to help us reduce the bad bugs in our gut and the infections, but then we're also reducing our good bugs. So typically it takes quite a while to recover, for our microbiome to recover after we've taken some medications. Sometimes it takes 2 to 3 months, sometimes even more. And we have to go back and change the pH of the stomach once the H. pylori has been killed off. And so all of these things it's like a dance we have to do afterwards once we've gotten rid of and eradicated the H. pylori and the dormant pieces as well. H. pylori, one of the biggest things that people, when they come to me, if they have low B12 or low iron for a longer period of time, I know that it's probably a hidden infection they haven't found. So it interferes with this nutrient absorption, which can lead to fatigue, which can lead to autoimmune conditions, which can lead to neurological conditions. B12 is essential for our nerves and our nervous system to work. And if we are not able to absorb B12, we start to get a lot of issues with our nervous system. So if you're feeling tired and have weird vitamin levels and you're not quite sure, talk to your healthcare provider. Have them check you for H. pylori. It's not a difficult test. There's a breath test, there's a blood test, there's a stool test. Super easy, but really understanding what's going on inside can help you really heal. Okay. H. pylori has been linked to lots of other problems. Like I mentioned earlier, there's some linkages between H. pylori and the bacterial bubbles it cells and the toxins and Alzheimer's and cognitive decline. We know that IBS sometimes can be triggered by chronic imbalances in bacteria, including H. pylori, and low stomach acid, which creates, the setting for poor digestion right from the get-go. Constant infection in your immune system keeps your immune system alert. And so it can also trigger autoimmune conditions. So lots of autoimmune links. One of the most common ones that I see in my practice is Hashimoto's thyroiditis. I'm not sure if that's because that's where I came from. And so that's the energy I put out there. But when you treat the H. pylori and fix the digestion, you can improve those autoimmune markers, those thyroid antibody levels. As I did, mine are negative now and have been for almost 8 years. So there is a way to put those autoimmune conditions in remission. One of the reasons why the immune system does that is because you have this chronic infection that revs the immune system up. These little poisons and toxins being put out in your gut lining, and even these little vesicles of toxins being released in your gut. And so the immune system gets really, really revved up. And so then there may be something called molecular mimicry or chronic inflammation. Molecular mimicry is that their body mistakes a certain organ or tissue for being a dangerous stranger because it's already revved up. And in this case, for Hashimoto's, it sees the thyroid cells as dangerous strangers and starts to attack the thyroid. So the the problem or the reason we have this Hashimoto's thyroiditis in this particular case when it's caused by H. pylori is literally that the immune system is trying to attack the H. pylori that attacks the thyroid. So just changing the thyroid numbers on your lab test doesn't actually stop the destruction of your thyroid, and your thyroid medication goes up and up. By understanding that H. pylori or any other bacteria has created an immune system dysfunction in your body, and fixing that piece will calm the immune system down to react when it needs to and shut down when it needs to. And you will stop attacking those tissues. So this is a really big piece of autoimmunity. And we'll get into that at another webinar when we talk about autoimmunity and the roots of autoimmunity. But in this case, H. pylori does have some direct links to autoimmune conditions. And again, we talked about why treatment doesn't always work, incomplete dosing because it's challenging sometimes. The side effects are quite harsh: nausea, vomiting, sometimes really bad stomach pain, as my family members have had. It can become resistant to medications. We've heard about lots of different bacteria becoming resistant. Bacteria can hide and become dormant. And then there's that risk of reinfection we didn't talk about, where if you have loved ones that you are sharing, common spaces with, and not airborne, usually more saliva and food. You take a bite of something, someone else that takes a bite, you could risk reinfection. And if you have done the traditional conventional way, you may have created some, dysfunction in your microbiome because of the medications you had to take to help with the bacterial infection and never, repopulated your gut microbiome. So, these are some of the many reasons why the treatment isn't always working, isn't always successful. So how can integrative medicine help? And I have seen it. I mean, again, it drove me initially to become a functional medicine practitioner. I have seen all kinds of different people from ages. I had a 6-month-old whose mom happened to test herself for H. pylori, and her other son, 4.5, and ended up testing her 6-month-old, and he had it as well. So we've done lots from 6 months to my mom, who was 83 the last time she had an H. pylori infection. Um, and you really have to approach the whole digestive system. So we use a 4R gut health plan or approach where we remove the problematic elements first. That's the first R. Remove the H. pylori. So it's really, really important to make sure it's gone. So if you are doing the conventional route, you are taking the antibiotics, make sure after a month you recheck to make sure there's nothing left, because those dormant cells can come out. And I think the antibiotic therapy is about 2 weeks, give or take. It depends on what combination you're doing. And after you've done that and you have no more H. pylori, that's the first step. You want to replace the missing digestive support. So the stomach acid, you want to test stomach acid. Make sure you have enough stomach acid. Your doctor can do this. And there's some great tests online you can take a look at to see, is your stomach acid been affected? It's almost always the case. So you want to reintroduce your stomach acid production, re-stimulate it to make sure that you're actually able to start digesting. H. pylori shuts down your whole digestive tract. So if you are not making stomach acid, you can't turn your enzymes on. You can't break your food down. You can't get nutrients. You can't keep pathogens from coming in. And you get a whole list of problems all the way down. And treating those problems downstream is not going to help until you start replacing that missed stomach acid or digestive support that you need. Then you want to re-inoculate with good bacteria. And we do it with all different things, depending on what your bacteria and the testing that we do looks like. You want to repopulate the gut microbiome. You can do that with probiotic food, probiotic rich food like sauerkraut, pickles that are in salt and water, kombucha, kefir, anything that's got bacteria in it. You can help, and it's going to take some time, and then you have to repair the gut lining. And repairing the gut lining is as easy, for some people, if the bacteria is balanced, then using bone broth is really easy. There are lots of supplements you can use, and I'll go over a case study in a bit to show you kind of some of the things we have done. Although I have to say, every single H. pylori patient has a very specific start and a very different path based on what other things we find in their gut, because there's always, some secondary problem stemming from the long-term, infection that they had. So you might want to ask your healthcare team that you're working with, if you have H. pylori, if you find you have it back, when it's gone, what can I do to protect myself while I'm treating the H. pylori, and what can I do afterwards? These are really important things. What can you do with food? So, what have we seen in the literature? So, cutting out processed foods, always a no-no. It's always inflammatory, and these processed foods and sugars feed the bad gut bugs. So, if you're taking the antibiotic because you have to, and you want to make sure you're proliferating your good bugs, your good bacteria, you want to be eating whole foods. You want to be eating plants. You also want to have gentle meals until your stomach acid starts coming back. You want to cook protein-rich foods to help heal the lining if you have some ulcers and some tissue damage. You want to chew slowly. You want to breathe when you're chewing so that you can stimulate that vagus nerve to help produce more stomach acid. And you don't want to have large meals close to bedtime because you want to be fully digested before you lay down, just in case that esophageal sphincter still hasn't come close because your stomach acid is still low. There's really good research showing that broccoli sprouts that are full of sulforaphane, and here's broccoli, but broccoli sprouts, and I want to say that research studies showed something like a half a cup a day lowered H. pylori and calmed the inflammation specifically. And they looked at pre and post 8 weeks. So you know, if you like to try and heal through food, you can buy those broccoli sprouts, eat them for a month, eat a little bit every day, like a cup to a half a cup. Throw it into your salad, steam it. It doesn't matter. But what's most important is that you try and rebalance your microbiome and you try and get rid of these things. Polyphenol rich food like berries, all kinds of berries, green tea, and olive oil can also help feed the good bacteria in your gut to help push out that imbalance if you have an imbalance afterwards. Um, and it can help inflammation and heal the tissues. What's really important is that if you have made dietary changes, maybe you've stopped eating all onions and garlic and things like that because it increased your reflux and caffeine. And when you start to heal, give it some time and reintroduce one thing at a time, especially if you have had ulcers. It's really important to make sure you are slowly reintroducing foods. Bubbly drinks are a no-no. They really make it worse too. And working with an expert or your healthcare provider who's really done a lot of this, I think is most important so that you get the personalized care that you need. Here are other things that I have found in terms of supplements that work really well, that are really non-toxic, not, pretty easy to take. We want to use some probiotics. There's all different kinds of probiotics, the lactobacillus kind and the beneficial yeast called Saccharomyces boulardii. Those are excellent to help boost that gut immune system, that Saccharomyces boulardii, and help rebalance that gut microbiome. And lactobacillus is one of the biggest ones we have. Fermented food contains some lactobacillus as well. Mastic gum is a gum from a plant, the mastica tree, uh, found in Greece. Um, and mastic gum it really has been shown in the literature, and actually I've found it very, very helpful in clinical practice to use supplements that have mastic gum for a couple of months to really get rid of those latent phases for H. pylori. It's a sticky gum. It's not even antimicrobial, so it's relatively safe. And I've seen a lot of clinical success in my practice, even for my patients or my family members who have done the triple therapy and it hasn't worked for a multitude of reasons. Um, and I use it as a treatment afterwards, or I add it on afterwards because I found it to be extremely helpful. And acetylcysteine can help get rid of those biofilms, those germ biofilms. So you might want to take that first before you take your antibiotics, so it makes them more effective to kind of clear out the layers, even if it's just a couple of weeks. It can enhance antibiotic effectiveness. And you do want to discuss dosages with your doctor so that you make sure you're doing what's right for you. And then afterwards, you want to aid in your stomach's protective layer. So if you have some heartburn right now and you're looking to get to the bottom of it, but you're taking Tums, let's say, and you're taking antacids and you're lowering your stomach acid production, and now you know, oh shoot, I may have low stomach acid. I'm making my problem worse. You could take deglycerized licorice in a pill that you chew it. It makes a bit of a foamy paste, but it lines the esophageal lining to protect if you have any small ulcerations while you're healing. If you have very, very high blood pressure, deglycerized licorice can have a little bit of effect. So just that's a caveat. Take a look at the back of the label so you know exactly how to do the dosing. Zinc, carnosine, and L-glutamine are excellent for healing abrasions and irritations in the stomach lining and the gut lining. So they're very well tolerated, very easy to use. Best to use them after the antibiotics. And again, I always tell people to consult a doctor or a specialist. I think it's really important to make sure you're doing the right, not only the right things for you, but in the right order, because the order really helps inform or helps with the outcome. And if things aren't done in the right order, sometimes the outcome isn't as good as it could be, which is why I always encourage people to work with a provider who's, really knows what they're doing when it comes to any kind of bacterial infection. So if you think you have H. pylori, and I know a couple of you on here were going to get tested, so if you have it, if you don't know, you go get tested. It's super important. Go to your doctor, get tested. If you're in a state or a province where you can't get tested, your functional medicine practitioners can order a stool test that has H. pylori on it. The one we use from Diagnostic Solutions Lab also has virulence factors, so I can see, is there a risk for ulcers, is there a risk for stomach cancer, which was a big deal for me because both of my grandfathers died early in their 50s of stomach cancer. So me finding that I had H. pylori really set the trajectory for me doing functional medicine, and hopefully help me avoid these things. You want to follow all the treatment that your medical provider has prescribed. Report any side effects to them. That's really important. And stay hydrated and eat really easily digestible foods, and avoid alcohol and anything that's irritating to the stomach, spicy foods, lots of caffeine. And afterwards, this one I should have highlighted. So important. Check stomach acid levels after. So you can have your doctor do that. I do a simple baking soda test. I didn't put on here. Look up baking soda test for stomach acid. It's really easy to do. If you have low stomach acid, then you want to go about either working with a practitioner. You can look online. There's lots of research on how to stimulate your vagus nerve to help you start producing more stomach acid post-infection so that you can start healing your digestive tract. You can use probiotics for a couple months post treatment. We talked about lactobacillus and Saccharomyces boulardii. And gradually, maybe a month or two in, start introducing these fermented foods because sometimes they can irritate the first month. So just slowly, slow and steady wins the race. This is a long-term infection for most people, so it takes some time to heal, but then you're done with it. And I tell people get retested after a month of treatment. Make sure that H. pylori is gone. And you might want to have your family members tested to make sure you're not reinfecting each other. It's a really important piece. Okay, so a caveat here, if you have an H. pylori infection, you're trying to treat it on its own, you're doing combination therapy, if you're vomiting or bleeding anywhere, vomiting blood or bloody stool, you got to go to your doctor right away. You got to go to the emergency room. If you have unexplained weight loss, problems with swallowing, worsening symptoms, really bad fatigue, really bad heartburn where you can't sleep, you can't eat anything, you've got to go to your healthcare provider. And you want to make sure, because you don't want to leave this to the place where you could uncover something like stomach cancer. So, key takeaways, please discuss H. pylori testing with your provider, especially if you have that kind of IBS, low iron, maybe heartburn and they've tested. Maybe that's one people test. But for these other things, brain fog after eating, it's really important to just eliminate it from your list of things that it could possibly be, because early awareness, I think that knowing what's going on inside really prevents years of suffering, years of nutrient deficiencies, which trigger other things that can become so much more difficult to treat. So again, educational resources only. So let's go to my case study here. So I told you me as a case study. One of my teenage sons, when he was 10, also had an H. pylori infection. A little harder to keep him on board with it. We were able to eradicate it. Mother had it as well, able to eradicate it. So this is Mary. Mary was a 27-year-old with chronic digestive issues, IBS, for about a decade. You're not feeling well, um, lots of digestive issues, constipation, bloating, acid reflux at times, but not at other times. Lots of anxiety, unexplained sometimes, insomnia at times. And why she came to me, actually, she didn't come to me for any of that stuff. She'd accepted that's who she was going to be. She came to me because she had hair loss, and that was really upsetting to her. Some chronic yeast infections, severe PMS, but the hair loss, and that was from the low iron. So remember, if you have this some strange symptoms that you don't want to connect back, micronutrient deficiencies can cause all these things. Low iron, and she was taking iron, and she still had low iron. She had done a bunch of different things, like a very strict low FODMAP diet. She had low FODMAP diet. Basically, you're not eating a lot of vegetables and fruits to starve out the bacteria, but it's not the fix. So if you have IBS and some healthcare providers said to you, just go on a low FODMAP diet, you can't live on a low FODMAP diet because you have to feed your other gut bugs. You can do it to get rid of symptoms, but you actually have to get rid of the reason that you have the IBS. Whatever's irritating your bowel, so you can get rid of the irritated bowel syndrome. That is like the funny thing that I think is quite funny. Not funny when you're suffering from it, running from toilet to toilet and not figuring out, really This is life changing for people. What we found in her gut, we did a GI map and an organic acid test. The GI map is a stool test. We found high levels of H. pylori. We found a parasite called Blastocysts hominis in high levels. Probably there because she didn't have enough stomach acid and she picked it up somewhere. She did a lot of traveling. She had an imbalance of good and bad bugs, dysbiotic flora. We tested stomach acid, it was low. She had impaired digestion. Her pancreatic enzymes were low, and she had fat in her stool. This wasn't on here. She had fat in her stool because she wasn't able to break her fats down. Because stomach acid also helps with gallbladder contraction, which helps bile be released to help us break down our fats as well. And she had this low gut immune system, this low secretory IgA, which had come from a chronic, I don't know how many years she had the infection, and then this dysbiosis. So her body was a mess, and all she wanted was her hair to grow back. Oh, and in the end, we treated all these things. It was in 8 months. The first 3 months, we really worked at boosting the gut immune system so she could tolerate things. So we didn't just go in there and kill the bugs. She had poor detoxification pathways as on her organic acid test. So we made sure we boosted her body's resilience in terms of her immune system and ability to detoxify, and then spent 2.5 or 3 months killing the H. pylori with different things, biofilm busters, some mastic gum, some other herbal antimicrobials. Then we as she was changing her diet, because the diet and lifestyle is the biggest piece. We worked on Her health coaches worked on vagal nerve exercises to help bring back her stomach acid. Afterwards, we tested the stomach acid was low, so we had to then she went back to her doctor to make sure the H. pylori um, was eradicated so that we could start the business of bringing back her stomach acid so that she would not get a reinfection or have other dysbiosis. We had to kill her parasite. There were so many things, but in the end, her hair, she started to get baby hair. She stopped losing hair. That was the biggest deal. Just stop losing hair but that constipation and bloating and the acid reflux in 3.5 months was 80% better, which was a huge thing because she just accepted this as normal. And at 27, which always breaks my heart. So, um, it's really, really important if you have this chronic IBS and if you're eating really well. If you're eating garbage and you have IBS, start with cleaning up your diet. It's really easy. Seed oils are really inflammatory, and processed foods can really be hard on our digestion. But if you're doing all those things and you're chewing, and you've looked at some of my other webinars about just optimizing digestion through like everyday simple things like sitting and breathing when you're eating and chewing your food. If you've done all those things, it's time to dig deeper. It's time to look and see if you have an H. pylori infection. It's time to make sure that you're not setting yourself up for other more serious chronic health conditions when you can easily get rid of this with some work, but it's not, it's definitely doable. So if you are in that area, and thinking about trying to change your health and don't know what the first step is, we have this amazing offer today. Um, it's a metabolic assessment. And what we do is you fill out a health history form, which actually gives us an indication of how all of your digestive organs are working, gallbladder, stomach, large intestine, small intestine, um, and it will help uncover some of the weak parts so we can give you just a start or suggest, hey, we really need to go get this checked. You can get some clear insights about how the systems in your body are working. If you're looking for more energy and to not have cravings all the time, one of the things that's really interesting is patients who have micronutrient deficiencies because of some sort of bacterial infection or some issue with digestion and absorbing nutrients, they're never satisfied. So they're always eating because their body is always hungry because it's nutrient depleted. So maybe that's you and you think, oh, I have no control over how I eat, or I don't feel good. So when I eat, I feel a little bit better. And that can be because you're actually micronutrient deficient. And that nutrient deficiency is driving your body to try and eat more. If you have really bad skin, rashes, really bad acne, you can get clear skin when we see how your metabolic processes are happening, how your systems in your body are working. And definitely, this is one thing I see across the board from like 10-year-olds to 70-year-olds. The focus and the brain function always works better when we identify nutrient gaps and we fix the way the body's working in terms of digestion to balance out the hormones and balance out the neurotransmitters. We're offering it for $199 today. You fill out the form, then you meet with me. We go over it, and I give you some really good, tailored, personalized suggestions for you as a first step to understanding what's going on in your body and how you can take that first step to healing. How do you book it? So on our website, bosnerhealth.com, you can go and this page will pop up and you'll see Dr. Kristina here. You'll go to Dr. Kristina. I don't know if this is not big enough for you guys. And you'll go to the link that says metabolic assessment special offer, and you'll click on there and it'll take you to the booking site. If you've just been sitting on the fence, you're not quite sure where to start, maybe you know you want to start. So reach out to us. Maybe you have a family friend that's been suffering. This is a really great way for people to get some sort of understanding about what's happening. Um, and for me to give you some personalized supplement recommendations and or like some really good advice about where the next step is. If you've been suffering for a long time, I hate to see people suffering. Sometimes it's so easy that people look at me and say, I can't believe I've been suffering this long. And so if you're not looking in the right places, sometimes you suffer for no reason. So um, if you know someone or yourself are suffering, jump on this website, book your metabolic assessment. Let's get together. Let's see what's happening and let me help you fix it, or at least get some idea of where you can start. I think that's a really good place to start. Thank you so much for joining me here. Share this with anybody you know who's having chronic IBS or GERD or reflux. I can't only help so many people in my office, so as much as you can share so people get educated and learn about how they can help themselves, that's great. If you want to connect with me online, I'm on Instagram at Dr. Kristina Bosner. I'm always posting information there and research studies and articles and recipes for healing. I have a lot of YouTube videos. So for those of you who do have poor digestion and you haven't watched the optimizing digestion video, it's a great place to start. The Dr. Biohacking Supermom is my YouTube channel, and our website again is bosnerhealth.com. I offer one-on-one functional medicine programs if you're looking to go deeper. Some of you on this call have already spoken with me quite a few times, and we know that that's the place to go. So I look forward to seeing you. I hope you use this information to help yourself and to help others that you love. And I look forward to seeing you guys on our next Ask Dr. Kristina. I don't know if there's any questions. If there's any questions, I'm here for the next couple minutes. If someone wants to stay on and leave a question, I can invite you to ask the question, or you can put it in the chat. See the chat. Nobody. Okay, well, hopefully I've answered all your questions. If not, again, feel free to reach out to me on Instagram. Um, and I hope you guys have a wonderful, wonderful afternoon. Oh, hang on a second. Looks like something happened here. Oh, there's a question. I have high iron and B12. Well, if you have high iron and B12, that's also a problem. High iron can be extremely inflammatory in the body. You should be maybe checked for hemochromatosis if you've never been checked. It's actually kind of a interesting thing that doesn't get checked often, but usually when there's an inflammatory process going on in the body, our body creates high iron and it becomes more inflammatory. So it's something to definitely check out. If you were taking your B12, if you're taking a B complex and you get blood work done, your B12 might show high. So if you are looking at um, your B12 on blood work, make sure you're not taking B vitamins a couple of days before so that it doesn't look high when it's not actually high. It's your supplement. Charlene, you have a question? Yes, there will be recordings going out in about a week and a half or so, and it'll also be uploaded to our YouTube channel. So you can definitely take a look there. Um, and it'll be there, but it will be sent out to anybody who registered to the webinar. It'll be sent out on a link so that you can share it with someone if you'd like, and help someone out. I hope you guys have a great day, and we'll see you next time on the Ask Dr. Kristina.